Coming up tonight, health deploys medical specialists to the West. A look at how government policies are boosting investor-level confidence, and cases of child abuse reported directly to the Social Welfare Ministry. Good evening, I'm Michael Ranamalo. Since the implementation of the Public Health Emergency Order on Friday, the Health Ministry has activated their response team and is sending a group of specialist doctors down to the Western Division.
Following the recent floods in the Western Division earlier this month, there have been 18 confirmed cases of dengue fever, 26 confirmed cases of typhoid, and 39 of leptospirosis. As a result, a team of specialist doctors have been deployed to affected areas to address the increasing number of confirmed cases of leptospirosis, dengue fever, and typhoid. Health Ministry spokesperson Penny Namotu says these doctors are currently holding head positions at their headquarters and are the country's leaders in post-flood situations. The ministry reveals that they are continuing with their preventative measures and are still fumigating homes to make them livable and assisting in places where there is a lack of proper sanitation. However, they're calling on families to continue practicing preventative measures, such as washing your hands after visiting the toilet or before cooking food. Namotu says people need to be cautious as the carriers of typhoid, dengue fever and leptospirosis are humans, animals and mosquitoes. The team is expected to be in the West tomorrow.
Tourism and Trade Minister Ayaz Syed Qayyum says government's consistency in policies augurs well in terms of raising the level of foreign investment to our shores. Speaking to hoteliers at the 15th Aeon Fiji Excellence Tourism Awards, Syed Qayyum urged the need for all stakeholders to work together.
So what we need to inculcate in the frontline people, as the Prime Minister is also saying about governmental agencies, is that any guest should be treated the same as any other guest, irrespective of where they come from, irrespective of whether they're from Suva, Beijing, Mumbai, Canberra, Auckland, New York, or Berlin. Everybody must be treated alike.
Consistency and hard work by government are the two factors that has generated an overwhelming amount of positive responses by foreign investors into the country. Tourism Minister Ayaz Syed Qayyum says government continues to review and bring policies to be in line with the current changes happening globally in ensuring that Fiji remains way ahead of its competitors.
The Tourism in Fiji recently carried out an audit in terms of rebranding itself, and they surveyed visitors from Australia, New Zealand, North America, China, India, UK, Europe, etc. And the two key issues that came out from the Chinese and the Indian surveys was that one of the surveys said they treated us differently, but as soon as they found out we weren't locals, they treated us better. In the same way, you will find a lot of locals who go to resorts or properties. They will also complain to you they may not have necessarily been treated equally as the tourists, the foreign tourists.
Syed Qayyum urged hoteliers to continue to work alongside key stakeholders in moving forward in ensuring that consistency is maintained, given that exciting times are ahead for Fiji's tourism sector this year.
These are enormous opportunities, and we must not lose sight that at the end of the day, we may have the best facilities, but if a guest is not treated right through the age of Facebook and Twitter and emails, etc., they could completely demolish our image.
Since the implementation of the Child Welfare Decree 2010, over 70 cases of child abuse have been received. Permanent Secretary for the Social Welfare Ministry, Govt Sami, made this revelation at the recent Leadership Symposium for inspectors at the Police Academy in Nasova earlier this week.
It is mandatory under the Child Welfare Decree that all child welfare cases are reported to the Permanent Secretary for Social Welfare. The decree is in response to concerns by health professionals at the increasing incidence of child abuse cases that are being seen at the various health facilities around the country. Objectives of the Child Welfare Decree 2010 are to ensure mandatory reporting of cases of breach of safety, to promote welfare of children by medical professionals to appropriate authorities. Reporting professionals include medical officials, that's doctors and nurses, police officers, and even welfare officers. According to the Permanent Secretary Govt, there has been over 70 cases of abuse lodged with the ministry. He informed police at the leadership forum that was held earlier this week that sexual abuse was the highest, with 30 cases so far. Physical abuse had been close to 22 cases, malnutrition had 12 reported cases, with 10 cases of neglect and 6 children abandoned by their parents. A national child register has been established by the ministry in response to the reporting so that they can look at the trend and do relevant policy changes with developments. Govt further adds that the ministry is now looking at having teachers becoming reporting professionals as well.
Coming up after the break, police urge parents to vigilantly monitor children's safety and whereabouts at all times. NITA series sets target to achieve food sustainability and recognizing Fiji's hoteliers.